Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, in the retinitis pigmentosa, we have atypical forms of retinitis pigmentosa. These atypical forms of retinitis pigmentosa are: first, there is retinitis punctata albicans. In the retinitis punctata albicans, instead of the bony spicules, we see presence of white dots are seen in retinitis punctata albicans. Then we have sectoral retinitis pigmentosa. In sectoral retinitis pigmentosa, only a sector of the retina is involved in sectoral retinitis pigmentosa. We have pericentric retinitis pigmentosa. Normally, the retinitis pigmentosa will start from the mid periphery, but here the retinitis pigmentosa will start from the center and it progresses outwards. That is called as pericentric retinitis pigmentosa. Then we have retinitis pigmentosa sign pigmento. In sign pigmento, retinitis pigmentosa sign pigmento, instead of the presence of bony spicules in the fundus examination, we see salt pepper picture is seen in the retinitis pigmento sign pigmento. So these are the different types of atypical retinitis pigmentosa.
thank you and thank you for watching.